Previously, our mothers used to give birth at 16, 18 years, right? So that by 35, 40 years, they have 11 or 12 children. Now, because of school and career, our first childbirth probably will be around 35 years. And that puts us at risk. So if your first childbirth or your first completed pregnancy, please, it is not first pregnancy. If you get pregnant at 22 and you abort it at 2 months, you don't get that protection. You are talking about pregnancy that you carry to term. So if your first full-term pregnancy is after 30 years, then you have a higher chance of getting breast cancer. It's a risk for you. Nulliparity. If you are not giving birth at all, then that is also a risk for you. So nulliparity is a risk for breast cancer. Smoking. In fact, these days when we talk of smoking, we don't see the typical cigarette smoking, what we call the jot. Jot na nkofo no no. Say yehu sa jot no biem. What actually is coming up now is what we call the shisha. And one path of shisha actually is like taking 100 sticks of the usual cigarette. So if the cigarette is giving you that risk, you can imagine what the shisha will do. Unfortunately, because the shisha is flavored, apple and strawberry and all that, when you are taking it, you feel it is good, but you are putting yourself at risk of getting cancers. Of course, not breast cancer alone. Lung cancer and lip cancers and other cancers also will come with smoking. Then alcohol. All the alcohols that we know, I don't want to mention any alcohols name, but we know them. All the Yebudidis, the VC10s and the rest. And every alcohol is alcohol. It doesn't matter whether it is spirit or it is beer or it is whatever, as long as it is alcohol. So too much alcohol intake is very bad for you. Obesity. If you are getting fat, if your BMI is getting high, please, you have to be very careful. So obesity is a high risk of getting breast cancer. Then fatty diet. Yeah, a pesra the number no, and one a chase no. Those who put us at risk of getting breast cancer, and lack of exercises. So if you are always living a sedentary lifestyle, and that is why I'm saying that now, because we are adopting this westernized style, our risk is getting higher. Because from the house, I drive from the house to the workplace, and then when I go, I sit by my desk all day. If I want to go upstairs, instead of taking the staircase, I'll use the lift and go up, come down, drive back home. I get home at 7 p.m., eat my supper, sit in the sofa, doze off, go to sleep. And that cycle repeats every day. That is a higher risk. So we need to exercise. Oral contraceptive pills. If we take oral contraceptive pills for a very long time, it puts you at risk. However, if you were taking it previously and you stop it, over a period of 10 years, the risk comes back to like for the normal population. So if you have taken oral contraceptive pills before and you stop taking it, the risk comes down. But as long as you continue to take it, then the risk is there. And then the other one too is women who are on hormone replacement therapy. Because of the discomfort that comes with menopause, some women tend to go for hormone replacement therapy. But once you start taking that, know that you are putting yourself at risk of developing breast cancer. And then not breastfeeding also puts you at risk. There is this hormone, this protein in breast milk that protects the woman against breast cancer. Okay? Now, it's called the lactalbumin. If you are breastfeeding, you tend to secrete this protein. And this protein tends to attack abnormal cells that may come in the breast and also improves the immunity within the breast. And therefore, if you are not breastfeeding, you don't get that kind of protection. So women who tend to breastfeed their children for at least 1 year, up to 2 years, protective. But if it is less, then you don't get that protection. So it will be better for you to breastfeed. And when I'm talking about breastfeeding, I'm not talking about adult breastfeeding. I'm talking about breastfeeding babies and producing breast milk. So let's take note of that.